Hello, everyone. I'm back with part three of the NHA phlebotomy exam questions. So let's get right into it. I'll be probably doing 20, maybe a couple more, maybe 25 questions. So we're going to get right into these questions. Okay. Number one, after a phlebotomy technician performs a heel puncture for neonatal screening, which of the following is the correct procedure for collecting the blood? The choices are smear the blood on the circle, saturate each circle with 1 drop of blood, touch the heel to the center of the circle, apply multiple drops of blood on each circle, and the correct answer is saturate each circle with 1 drop of blood. When performing a heel puncture, the technician should wipe away the first drop of blood and then saturate each circle with 1 drop and allow it to dry for 4 hours. Okay. Number two, one moment, let me just put my glasses on here. And these questions are really good also to study them when you get ready to get your first job, phlebotomy job, because I have actually worked as a phlebotomist. You have to take your test every 2 years, so I know that you're going to be doing a lot of this stuff, a whole lot of it. Okay, number two, a phlebotomy technician is removing a bag of contaminated items from a collection area. Which of the following actions should the technician take to properly dispose of each item? Okay, and let's see here. Transfer the contents of the bag into a different hazard waste bag. Transfer the contents into a large trash bin. Take the items directly to the dirty utilities room. Place the bag inside a second hazard waste bag outside of the room. And the correct answer is place the bag inside a second hazardous waste bag outside of the room. And that's going to be, well, that was on my NHA exam, so that will probably be on the exam. Number three, a phlebotomy technician is preparing to draw blood from a patient who states that she fainted during her last blood draw. Which of the following actions should the technician take? So if someone has fainted on their last blood draw, you're going to want to ask the patient to lie down for the procedure. That's going to be the correct answer. To prevent syncope and possible injury to the patient from a fall, the technician should ask the patient to lie down for the procedure. Okay, number three. Which of the following actions should a phlebotomy technician take when reporting laboratory results? Okay, I'll read the selections for this one. Send the results to the patient's partner. B, send the results to the patient's personal email. C, send the results to the patient's ordering provider. And D, send the results to the patient's insurance office. And the correct answer is going to be send the results to the patient's ordering provider. That's the only thing that we are allowed to do. Okay. The next question, a phlebotomy technician is preparing to draw blood from a patient who states that this is his first blood draw. Which of the following actions should the technician take? Okay, and the only action that we should take is describe the procedure to the patient. Out of these choices, the choices explain the reason the test was ordered, inform the patient of possible complications of a procedure, show the patient the gauge of the needle, and describe the procedure to the patient. And an only acceptable answer is describe the procedure to the patient. Now, if they had to have verify the patient on here instead of that, that would be the best answer. You have to verify before getting ready to draw blood. But on this one, you can only just really describe the procedure to the patient. Okay, and the next question. The Joint Commission recommends using the patient's full name and which of the following pieces of information to ensure accurate inpatient identification? A, insurance carrier. B, medical record number. C, laboratory requisition number. D, provider's name. And the correct answer is medical records number. The patient's medical record number, a number assigned to the patient by a facility, is an acceptable form of patient identification. The patient's birthday and home address are also acceptable patient identifiers. Next question. A phlebotomy technician is performing a venipuncture using a winged infusion set. The red top tube fills, but the light blue top tube slows and does not fill completely. Which of the following actions should the technician take? Excuse me. A, tell the patient that another venipuncture will need to be performed. B, write insufficient quantity on the requisition form. C, submit the partially filled light blue top tube to the laboratory. And D, insert a new light blue top tube to see if it will fill. The correct answer is insert a new light blue top tube to see if it will fill. For the light blue tops, which goes to the coag department, you have to fill that one up completely to the line. They'll have a little line right under the blue top. You'll see it, and it says fill there. You should fill it to that one. The tube might have low vacuum. Instead of performing a new venipuncture. Okay, and the next question. A phlebotomy technician is drawing a patient's blood when the patient states that she is becoming dizzy and lightheaded. Which of the following actions should the technician take first? Place the head between the legs. B, remove the tourniquet and needle. C, call other medical personnel for help. And D, instruct the patient to breathe deeply. So the correct answer would be remove the tourniquet and needle. The first action the technician should take when the patient reports feeling dizzy and lightheaded is to remove the tourniquet and needle to avoid causing injury to a patient. Okay, next question. When performing a hand draw, which of the following steps should a phlebotomy technician take before removing the needle? A, ask the patient to release his fist. B, apply pressure to the site. C, disengage the tube from the adapter. And D, reapply the tourniquet. The correct answer is disengage the tube from the adapter. The technician should disengage the tube from the adapter before removing the needle. This prevents contamination and the dripping of blood. Next question. A phlebotomy technician observes a hematoma developing at the site of a venous blood draw. Which of the following actions should the technician take? A, observe the site to see if the hematoma worsens. B, ask the patient to apply pressure to the area. C, release the tourniquet and stop the draw. D, call for a nurse to assess the patient's condition. The correct answer is release the tourniquet and stop the draw. The technician should stop the draw to prevent the hematoma from getting larger and causing excessive bruising. Okay, next question. Which of the following blood tests should a phlebotomy technician place in ice immediately after collection? A. Ammonia. B. Cryoglobulin. C. Cold agglutinin. And D. Blood cultures. The correct answer is ammonia. The technician should immediately chill ammonia specimens following collection to prevent chemical changes that alter test results. Okay, next question. A phlebotomy technician is planning to collect a sputum specimen from a patient. Which of the following instructions should the technician give the patient? A. Rinse your mouth with mouthwash before we collect the specimen. B. Gargle some water before we collect the specimen. C. Leave your dentures in during specimen collection. And D. Breathe deeply and cough up specimen into the container. The correct answer is breathe deeply and then cough up specimen into the container. The technician should instruct the patient to breathe deeply and then cough up a specimen into the container. This increases the chances of obtaining a quality sputum specimen rather than saliva. Okay. Next question. A phlebotomy technician is informing a patient about how to enter a basal state for a blood collection. The technician should inform the patient not to consume food for how many hours prior to blood collection? A. 12 hours, B. 6 hours, C. 24 hours, and D. 15 hours. The correct answer is A. 12 hours. The technician should inform the patient that she should enter a basal state by not consuming food for approximately 12 hours prior to the blood collection. Next question. A phlebotomy technician is performing a blood glucose test. Which of the following glucose levels should the technician identify as being outside the expected reference range? Okay, A, 70 milligrams or deciliters. B, 120 milligrams or deciliters. C, 200 milligrams or deciliters. And D, 86 milligrams or deciliters. And the correct answer is 200. The blood glucose level of 200 milligrams or deciliters is above the expected reference range of 70 to 126. The technician should immediately report this finding to the provider. Next question. After verifying a patient's identity, a phlebotomy technician sees that the patient's laboratory results are ready. Which of the following actions should the technician take? A, have a laboratory manager discuss the results with the patient. B, have a nurse interpret the results for the patient. C, inform the patient to contact the ordering provider to obtain the results. And D, explain the results to the patient in a private exam room. The correct answer is C, inform the patient to contact the ordering provider to obtain the results. Only the ordering provider can discuss laboratory results with a patient. Next question. A phlebotomy technician is exposed to blood via a needle stick injury. Within how many hours should the technician initiate post-exposure prophylaxis? The correct answer is 24 hours. Nothing longer than that. The technician should initiate PEP within 24 hours of a needle stick injury. I would do it as quick as possible. Okay. Next question. Which of the following tasks is within a phlebotomy technician's scope of practice? A. Requesting a blood collection. B. Sharing new laboratory results with the patient. D. Providing instructions to patients for specimen collection. And D. Discharging a inpatient following a blood collection. And the correct answer is providing instructions to patients for specimen collection. Providing instructions to patients for specimen collection is within the technician's scope of practice. Okay. The next question. Blood cultures have been ordered on an adult patient in an intensive care unit. A nurse calls a phlebotomy technician to bring the appropriate materials. Which of the following materials should the phlebotomy technician bring? Okay, and we're talking about blood cultures. So A is 2 aerobic bottles, B, 2 anaerobic bottles, C, an anaerobic bottle and a SPS tube, and D, an anaerobic bottle and an aerobic bottle and an anaerobic bottle. And the correct answer is D, an aerobic bottle and an anaerobic bottle. The technician should bring a set that includes both an aerobic bottle and an anaerobic bottle. Okay, and blood cultures go, I don't know if it's important to anyone, but they do go to micro. After you do those, they go to microbiology. Okay. The next question. A phlebotomy technician is preparing to perform a finger stick for a patient. Which of the following actions should the technician take first? A. Cleanse the site with an antiseptic wipe. B. Select the appropriate part of the third or fourth finger. C. Position the blade of the lancet across the line of the fingertip. D. Confirm the identity of the patient. So the only acceptable answer is confirm the identity of the patient, because we know we don't prick the fingertips, we don't use the third and fourth finger, and we don't use those type of wipes. So the correct answer, if you just, because some of those questions you're going to have to just do the process of elimination. So you just go down each one until you see the ones that make sense. You may narrow it down to 2, and then you just read over those and pick the one that you best think that applies. Okay. Next question. Which of the following is the best method for a phlebotomy technician to collect a blood specimen from an older adult patient who has fragile, easy to collapse veins? A. Choose a butterfly assembly using a regular ETS tube. B. Choose a butterfly assembly and use a pediatric tube. C. Choose a syringe and a butterfly assembly and transfer to a ETS tube. D. Choose a pediatric tube assembly and a regular ETS tube. The correct answer is choose a syringe and a butterfly assembly and transfer to an ETS tube. So we know that we use syringe for people that have fragile, easy to collapse veins. The technician should identify that the syringe minimizes pressure on fragile veins and helps prevent collapsing. Okay. Next question. Which of the following actions should a phlebotomy technician take to prevent needle stick injuries? A. Lock the sharps container after every blood draw. B. Use a new sharps container with every blood draw. C. Recap a needle prior to discarding it in the sharps container. And D, replace a sharps container that has reached its full or fill line. The correct answer is D, replace a sharps container that has reached its fill line. Okay, next question. For which of the following reasons should a phlebotomy technician centrifuge a serum specimen before transport to an outside reference laboratory? Okay, and basically, you would do this, or the cells must be separated from the serum. If a specimen is not centrifuged, the cells continue to metabolize into the serum. Therefore, the technician should centrifuge a serum specimen before transporting it to the laboratory. Okay, next question. A phlebotomy technician is selecting a site to collect a blood specimen from a patient. After applying a tourniquet, the technician sees no apparent vein to use for the venipuncture. Which of the following actions should the technician take? A. Apply and inflate a blood pressure cuff to 60 mm. B. Puncture the area where the patient's vein should be located. Oh, that's B. And C, tap the area repeatedly until a vein appears. And D, have the patient dangle her arm for 1 to 2 minutes. And that is the correct answer. Have a patient dangle her arm for 1 to 2 minutes. The technician should ask the patient to dangle his or her arm for 1 to 2 minutes, for the veins will fill to capacity with blood. Okay, next question. A phlebotomy technician is preparing to collect a blood specimen from a patient. Which of the following statements should the technician take prior to performing the venipuncture? A. Your provider has requested this test. B. I'm going to put my supplies here on your bed table. C. I already have the supplies open to save time. And D. We can leave all the lights off during the procedure. And the correct answer is your provider has requested this test. Okay. And the next question, or the last question, is which of the following tubes should a phlebotomy technician collect first when obtaining dermal samples? Okay, and A is lavender top, B green top, C red top, D light blue top. So this is a dermal sample. So you're going to use the capillary bottles. So you know the order of draw changes when you do that. They kind of go in the reverse order. So lavender would be the first one. It would be a lavender top. Yeah, it should be lavender, then green, then red, then light blue. It will go in the opposite order that the regular order of draw is. Okay, everyone, I hope these questions help you. I will be doing another video probably tomorrow. So if you have any questions, just feel free to leave me a comment and I will get right back with you. Otherwise, I hope everyone has a great time studying these and has luck with them. And I just hope they help you. Thank you all for tuning in. Please subscribe because I will be doing more videos. I will be taking you to work sometimes just so you can get a feel of what the phlebotomy, what we would do in a day in the life. Okay, so thank you for watching. Goodbye.